Hi, our next resource person is Master Professor Segar. Master Segar Guru. He is a yoga master from Malaysia, a motivator, health activist, spiritual science teacher, peace activist, researcher, Burma practitioner, and founder of the Malaysia Yoga Wellness Association and Technology and Health Science Research Association, Malaysia. He creates his unique style of yoga to enhance teaching. He is the first Malaysia judge for the International Video Blogging Contest, My Life, My Yoga, under the Ayush Government of India initiated by our PM. He was selected and sponsored by Indian government Ayush for representing the country as a yoga expert in 2019. He was a international judge 4 times, including Thailand, Abu Dhabi, and Nepal. He is a gold medalist for World and Asia Yoga Championship. He has done he has done Malaysia Book of Record for first fusion yoga dance. He was awarded Yoga Bhushan title from India Yoga Federation, and he received a very a lot of many more award local and internationally. Now I invite Sri Master Professor Segar sir to enlighten us with his knowledge. Welcome, sir.
Vanakkam. Namaste.
Vanakkam sir,
Vanakkam, sir.
namaste.
Okay.
We'll
Hi,
be
I'd like
starting our
to,
session, sir.
yeah,
Is it all okay?
the sounds okay?
Yes, sir.
Okay,
Everything is fine.
that's great. Okay,
Yeah, we'll just join.
Vanakkam all.
Bye.
Okay. First, I'd like to thank Mr. Ratna Sababadi for giving me this opportunity, and also previously Mr. Jakaria. He's done a very good job for his age, and Mr. Radhakrishnan, and Dr. Ilagan, and Miss Gomez. I think you want to find out more about me, you can just go and visit maiwa.yoga. There you can just find out about what we all do at the sun. I like to just come to COVID. I don't like want to elaborate more on COVID because this is already is going on for several months. Most of us know what is COVID, but I'm just going to go on science based on the COVID. We're going to see some videos. We're going to have a look some on there. So based on that, you can just see what we can actually do for our body. You can put the first video, please. Okay, while waiting for the video, I just explain here. First video, we're going to see how we're going to identify what is COVID, plus how COVID attacks our lungs. What is actually is COVID at all? Where is a main impact? So that particular video, we can going to see a ciliar type of projection that move around to keep the mucus and debris out of the lungs. So that is how the process we're going to understand. Miss Amada, can put the video. Okay, I think the video is on. So I'll continue with our son. Once the video come, we'll just go into the system. So as you all see, daily there's a lot of cases. Now India is number 3rd place. Malaysia already is now in the recovery term. But what is to do with COVID and yoga? I'm sure many of you will be wondering. But this kind of disease is not the first time when it happened in the world. It happened quite a long time ago. Many times around the centuries, there's a lot of diseases, pathogens that have been attacking our immune systems. But how we can, you see, we have like yoga for mental health. We talk about for mental health first, okay? Poor mental condition, including stress, depression, and are known to increase the acute. So if you're stressed also, you're going to have a impact on your body. So if you're stressed, your immune systems will come down. So once your immune systems come down, automatically you are more vulnerable to attack by not only COVID, but with other pathogens. See, there's a rising number of COVID cases, and that's possible races of anxiety and with loneliness also. Even some people who are very lonely, they're staying also they have a high chances. I mean, this is all on scientific data that are being collected. So this is not just some, because you see, when you're going to sun, you have a depression. The depression, you don't eat properly, you don't take a healthy food, also you'll impact this. So concentrating the mind is another decision of Ayurvedic and yoga. Several measures of mental health are described, including pranayama and meditations. This is what even Ayush came out with this. Pranayama is known to improve lung function. Meditation is found to reduce inflammation markers and influence markers of wider specific immune response. So yoga, including meditation, could be a simple and useful home-based practice for prevention and post-recovery management of COVID-19. So before we go inside, I just wanted to show you, all our body have a biomagnetism. The most important thing is biomagnetism in our body. As it go less and less and less, the biomagnetism actually reduce. So once we are anxiety, we are afraid, there's a it's like a flow of current. You see, now I'm sitting here, actually there's a biomagnetism waves is going on. Maybe you all have seen in your school projects where you will take a magnet, then after on the piece of paper you put a magnet under it, then you put some leads or some iron bits. So you put some, then you can see they form a kind of circle. That is how our body actually is work. Our body is actually not only to the biomagnetic system, we also to the earth. We are aligned to the earth magnetic field, to the space magnetic field. So there's a lot of magnetic field interference with our body here. So we might understand that how our body. So one simple test I can give you now. Most of you, I think you were able to do this. You just take both of your hands, slowly you just go a bit like this and far, go slowly. You can feel something is pushing like this. That means something is like a pushing, but it's a invisible magnetic force. You see, this is an invisible magnetic force. Some people can expand. They even can expand up to the higher level. But the problem is, some people, they only can expand this much. After this, they cannot feel their biomagnetism. This is something like a car battery. If your car battery, the more lower go, the more chances to your car not able to start is that. So same thing, our body, our magnetism, once is go lower and lower, your body will prone to many sickness. You can get a sickness, you can get headache, you can get whatever, because the biomagnetism actually like this is a cell, two cells are divided by biomagnetism. In our body, there's no cells next to them. Even our skin, actually we are seeing here like a hardened skin, but actually it's a hollow. If you there's some microscope where you can just put some baby oil and you just put it under the microscope, you can see your see through into your veins using the tip of your finger. Under your fingernail, you can just see the veins, how the blood flow. It's a very simple Sunday. A lot of people use that for identify some markers into your one. So actually, when we see here is solid, but when we see under the microscope, easily we can see there's a hollow. There's never been a solid in our body. Our entire body actually is like more to hollow. We are just hold together by biomagnetism. That's why after a person died, or any animals or anything after the expired date, they tend to break down. That means any living organism, after a period of time, when the biomagnetism already come less, they can result to that. After that, they will start to break down, because the more biomechanism, even though person is dead, the biomechanism is still there in very low quantity. But as the biomechanism start to reduce, it will start to break down your particles of your body is to more. So once you can see the bones, why some people ask why the bones are there. The bones are also a living organism, but later they become like a permanent, this one like something like a what do we call iron bar, and a bone will be all will be have a similar characteristic, but will have a better uh, density there. So they will sound, but inside the bone, if you open and see, there will be already hollow already. That means whatever biomechanism that is moving inside is already been clear. Then after this, they'll have more uh, things they will break down. After some period, even the bones also can break down and become in the dust. So end of the day, biomechanism is for the entire thing. When I was doing a research around nearly 8 years ago, 10 years ago, I came out with a product where we can, it's an energy product where we can cure quite a number of sickness. So as we are running a test on humans, we find out that actually is the product carried a high amount of energy. Just a spray on your body, you can just can see even your scar, you can see in front of your eyes can loss. That means why the scar does not loss in the during normal time, because our body is like keep it a car battery. You have already you already maximum use for the car battery. So you're driving a car, but while you're driving the car, you stop the car, you put another which you already have your battery already reached your capacity. That means after this, you're not able to move forward. So you just put in another inside. What will happen? Suddenly the car may not able to start, or while it's moving, you'll just died off because the capacity already reached, and you cannot add in another thing. Same like our body. Our body have a capacity. That means we have only 100 volt only we can use for our body. So that's why when you see when we accident everything, our bodies tend to repair ourselves. So we will have to take rest. While we are taking rest, you can see our body faster recover. That's why when you go to hospital, anything, we have to take rest. For myself, I think already more than 8 years, I never take any medicines. And not only myself, I know quite a number of people who have never taken any medicines. So because why? Our body, we need to train them to increase our immune system. Now you take a medicine. What's the medicines do? The medicine will of course sometimes cure, because I know some cases where operation success, patient died. Because I know like one son they did for the boy heart operation, so heart alone. But what happened after 2 weeks? The boy died because the medicine that they took and gave to the boy to cure the son and went for the operation success, but the side effect impact the kidney. This one you can go through. I think many medical doctors they agree on this, that sometimes side effects, because even doctors can some all depends on our individual. If we can reject the side effects, or will have a big impact or small impact. So do we really need medicine? Yes, for emergency purpose we do need a sun. But if you like going for cough or cold or fever, all you can just very easily you can cure your own self. Starting when I used to taking medicine time, take me 7 days to cure. My body was immune. Then after I stopped taking medicines, also take me without medicine, take me 7 days. Then it reduced to 4 days, it reduced to 3 days. Now in 1 day, even few hours after I got any symptoms or sick, sometimes in few hours, I'm already back to normal. I just go take a nap, I'll be back to normal already. So your immune system is already working in a perfect manner. You should really focus on health and relax. Of course, now COVID, because during this COVID time, many of you all stay in home. That's a very good thing. Because even I last year told my students, this year many of them going to be have a high blood pressure, a lot of problem. But COVID actually if you see on another side of course is not benefit, but for the human health, for the rest of the world who have taken rest, have managed to recover their body with home cooked food. You see, first thing they're eating home cooked food. Like in Malaysia, they locked down for more than 2 months. Most of them have to eat home cooked food. So that will reduce the risk of eating outside. So your immune system actually increase it. Next, once your body start to relax, your body start to repair because we are not moving much, we are not thinking much, we are not even stressing. Some of them, of course, they work from home, but work from home also, some of them, the stress level is not so much, so they can still manageable. So this actually allow for our body to maintain a recovery period. So this recovery period, many of them have a very good benefit. So now once they go back outside, but what they should actually including some sort of exercise or yoga. So sometimes I do some online classes where my students come in. So I just teach them yoga because at least they have some muscles movements. You see, some of the aged people, they always tell, oh, I'm doing a lot of housework. I don't have time from morning to evening. I tell them, you never do from housework, but what benefits? And oh, I'm doing housework, I'm moving. It's not like the housework we do in our grandparents times. Grandparent times, we do manually. So the manual work self is giving us exercise. But now we are doing more to mental, and we are having a grinder, having machine. Of course, we are just moving. But now we have a washing machine. We even have a dryer. So people those days, after they wash the clothes, they just twist the sun. So once you twist here and here, you are twisting your arm, giving a good exercise. But nowadays, I think you can go back in your house and ask how many of you actually twist your clothes and dry it, open and dry it. Nobody. So these are the type of things that lacking in our daily life. Each of us, we can tell, okay, we are doing this, we are doing that, but there's a lack of exercise and yoga lead to different problems. So those days, our grandparents all live healthy because they have to take from the well. They have to pull the water from the deep from the well. They take one by one. They put in a small pail. They have to take and gonna wash the clothes. They're going to do everything. So that's actually a different thing. But now we don't have that. We just open a tap, the water flow. We take shower. That also no need to shower now. Now already more modern already. We just open and tap, the shower just pour. So at least we had to take and pour on the head. That also nowadays we are not doing that. So you understand that technology is good for us, but also make us more lazy, and we are instead of focusing on doing more to physical exercise, we are now focusing on more towards stress environment. For example, that means we are sitting in front of a computer from day and night. We are just sitting, you understand? So there's a lack of movement. Our eyes, our ears, because we are putting our headphone and listening to the songs while we are moving. Then we are sitting, the posture is not straight. We always sit, lie back, or just so. Once you lie back, you don't have any support for your lie back. That means you also not giving a good support for your spinal cord. So this is one of the area where you might understand that very core. So COVID, you must understand why is attacking people who's elderly or people with sickness, because their biomechanism is very low. When your biomechanism is very low, that is where 1 by 1 to 6, like I tell you just now earlier. So you must understand that if you do exercise, you can increase your biomechanism. But what exercise? Some of you say, oh, I'm going to gym, because I have students from gym who went to gym, but once they come to the yoga class, but actually they tell yoga is much more tougher than gym. I tell them, you're carrying 20 kilos, 30 kilos, but why you cannot do something? Because they thought, I don't know, yoga is much more tougher for me. For me, gym is much more. So that means I'll ask them. Most of the people coming for yoga class are ladies. Most are going for the gym are guys. So is lady more stronger than the guys, or guys are more weaker than the ladies? So that is the question normally asked. So they also can't understand that, because they also can't understand why ladies easily can do yoga, but guys having a yoga problem. So we might understand that we are guys are more like stiffness. We like the stiffness, but the stiffness also we should include and mix with yoga. So you need to have a flexibility, your nerve systems. See, once our nerve system is already a stiff, you want to move your muscles, everything will be you having a lot of problems. So the best thing is you have to do a flexibility training. Patanjali yoga came from Patanjali, but Patanjali yoga was started with 8 asanas, then become a 10, then later they adding. The most advanced level that Patanjali was giving was headstand. That's an advanced level. Other than that, all was simple, all for health purpose. So now we already have more than 10,000 yoga asanas. Some is going for 20,000, because you see, once you understand what is yoga, then you will understand a lot of things. A simple movement in a proper manner. You see, now you're eating this. Okay. This also we can tell yoga, because you see, in these 5 fingers, you have fire, air, space, earth, and water. So you have 5 elements. So nowadays people are eating spoon, so they can't say. So you put on your banana leaf, which have a good toxin. So you'll remove sometimes the toxin. So it's very good. So you put the rice. That's why the Indian, they have all a method. You have to put the rice, you put the sun. So when you mix and eat, you should eat with hand. So when you take sun, our biomagnetism here is more high, always a very high biomagnetism. So when we are taking this, when we eating sun, so from the space coming, biomagnetism is always coming here. So when we are taking it will include in the rice, and once you are eating inside, it will actually enter into our body and will increase our biomagnetism. But nowadays, we are doing what? We are eating a spoon. We just, even banana, we just put banana leaf also, we still eat in a spoon. So sometimes I just see, oh my God, why the, our culture already, and the purpose of eating on the already gone. We are following more to Western style, because Western styles, of course, that time they don't have a proper watery systems or something like that, which they have to use paper, they have to use some spoons to just, so they do not have to wash your hand. That means they do not have to waste water. But in India, it started with we have a lot of rivers. I mean, now of course the rivers already come down, but those days in India, there's no water problem. So always after eating, we wash. That means once we wash, you see, the energy from the river flow into our hand by the water. That means we just take and wash. After we eating, we washing, we are also improvising our biomagnetism here. So everything that we are doing washing. So instead of now we don't wash our hand, and some of us, we don't even wash our mouth after we eat. See, once we don't understand, so whatever the sun will just stuck. Some people, they tell, oh, I just drink water, it should be okay, just gargle a bit. The purpose is you need to gargle whatever impure items or whatever stuck to come out. So once you do that, automatically whatever you inhale your oxygen, because you see your trachea is here. We inhale through our nose, we go through the trachea. But if you never wash your mouth, what will happen? The debris, the small particles may travel down to your trachea. So when we inhale, exhale, so it may go to our bloodstream, which is supposed to go down to the digestion, but it can go to the wrong route. Of course, we have our bodies already have some, they allow some, but sometimes the dust particles. That's why we have the nose hair. The nose hair will actually block everything. So for COVID, we actually wearing one more layer of mask. But that mask, how effective? You see now, they tell the dust COVID particles are very small. So is they suggest a 3-layer mask, but most of us are not no more wearing a 3 layers mask. Plus, if outside maybe around 1 meter, maybe you can just see where people sitting. But when you are indoor in a cold environment, aircon is moving around, the fan is moving around. When a person sees you 20 feet away also, you still have a chances to get COVID because it's airborne coming to us because it's in close place, it's moving around. In our eyes, we're not able to see the air movements. But if you, by trained eyes or some instruments, you can see actually inside the room, close area, or I mean even shopping complex, the air is moving in these circles. So they are trying to move. So all the particles that are moving, they are just actually, so whatever we inhale, we also inhaling, not just next to us, but inhaling a bit far, maybe from first floor to second floor, we still can inhale if they are open shopping complex with a in the middle have a space, so it'll get actually can go up to the how many floors also. So because the blower that the aircon that has been blowing inside, they will just push the particles away. That means whatever toxin or pathogens, they'll just push it away. So someone very far, so inside the same environment, they have a chances to get the COVID. So we are talking about today about signs of COVID. Okay, so okay, I still waiting for the video. Once you can put a video, I can just try to go for the next COVID one. So just hold on for the videos. Okay. You see now, I was talking about biomagnetism. So we go back to because biomagnetism is the basic one. You see, okay, this is the Earth. Okay, just keep it. This is the Earth. We have knot and we have true knot. You see, we have a knot and magnetic knot. So they call it knot and true knot. So the magnetic knot is a different. So when you see the map, they have two. Not in, but nowadays the map they are more focusing on a magnetic knot. So when we are sleeping, keep it now. My head is facing east. My leg is facing west. So I'm sleeping daily in this. So what will happen? I having the magnetism is going this way. So there's a magnetism is going through my body this way. So now I change my position. I put my head towards knot, my leg towards sword. So what will happen? The magnetism from the knot pass through my head, go out through my leg. So sometimes people tell, don't put your head at the knot and sleep at the south, because those days people thought, oh, it's not good. But actually, those days have already explained, this is actually a pure science. So you want the the magnetic waves to enter inside and come out in a different form, not to reduce your biomagnetism. So you can see there's a lot of things that we are actually looking at this thing. So you want, okay, now we are sleeping here. The waves is coming this way and is going out. So now we are just seeing one by one. Where is we want to focus? The meditation through the chakra or natural? How many of you all have actually go for meditation? And what is meditation? Because many of you are mistaken meditation with a relaxation. They just sit, close the eyes, just focus. This is actually is not really a meditation. This is more towards relaxation. So many people say, I'm doing meditation. So they have the misconcept of meditation. Of course, both also is good. Meditation, you are more focused to the energies that are coming through. Relaxation, also you focus on energy, but you will get the benefit of not half, less than half also. So in the long term, how you want to bring your body up. So there's a lot of breathing techniques, which I will be explaining you after we see the videos. Okay, next we'll be going now. Like I tell you, the Earth. So Earth, they have their own magnetism, but Earth is moving around the sun. So the sun magnetism is pulling the Earth going around. So this is less biomagnetism, that means less magnetic field. The sun have a higher magnetic field. So when it's pulled around, it move with all sun. So once the sun already no more there, the earth does not move because the earth does not turn on its own axis. It turns using the sun's magnetism. So the magnetism power from sun, it turns and rotate the earth. So you may just see the same concept is happening to our body. So if we have a stronger biomagnetism, we actually have a like a shield. That means you see, now there's some kind of outer waves coming inside. So when we have a stronger biomagnetism, the heat that we coming together here will be less because here will have like a thick layer as unknown to the eyes. So you just like a block. But the less is come, the less sun. Same thing, whatever you eat, consume, whatever we breathe in. So when we breathe in some toxin or anything else, so once it just go into our body, automatically what will happen is when our biomagnetism is strong, that means we are talking now cell to cell. This cell to this cell, they have a strong biomagnetism. So they are actually they are more space. So they can push the one, so they can move more faster. But this is impure items that enter into our body. So once the impure items enter into our body here, biomagnetism is very less. They tend to merge with the pure items. So once they are merging with the impure items, that's where one by one thing will have a problem. So we can just see how we want to just go about this one. So just sorry, I just like to ask the video, Mr. Okay, now you see we have a what do we call? You go to magnetic field detector. So they detect the field magnetism using a field detector. They have some, but for human one, they use aura machine. Aura machine, you can just go for sorry. So the aura machine, you can see a kind of color aura here around here. Or if you're a trained specialist, some of the trained specialists, they can see through their eyes the aura of another person. So they can see, okay, so what's the aura to do with magnetism? You see, they have a trillion technologies, vision data. When you take a small leaf, you put on the trillion machine, and you just scan it, it will show the a kind of energy pattern. So any living objects you just take, you can scan it, they can show the same thing happens to our body. We have an energy, but maybe this side I have an injury. So the color that coming out from this side may be a bit slightly different. So that is one of the technologies now they are using, but they are not able to understand is what is exactly is happening to our body. So the more stronger you do meditation and yoga, pranayama, you have a more bigger level. That means instead of just slightly here, you will have maybe a bit this much. So you have a more protective layer. That means you have more enough power for you to get into higher immune systems. I always tell to my students, you don't need to go for medicine outside. The medicines are inside our kitchen. Traditional Indian kitchens, we already have all the medicines already. You just go inside, just put in some herbs and just Riki also is, we call it kasaya. But that one will really help you for a lot of boosting your immune systems. Because that is what I did for in my starting stage. After I stopped my medicines, if I have for my, like if I like a diarrhea, I'll just go, I'll take some spices from the kitchen, just mix it. Some spices, just put it in, mix it. Then I just take some tea or the Lipton tea like that, we just put inside and I'll just boil it for 10 minutes, a slow boil, then I just drink it. You'll just maybe 1-2 times maximum. But after that, after around 1 year plus, even that also I stopped because I want my immune system. So since then, even I have a diarrhea or anything, unless it's a really some people they go to doctor when they have diarrhea. They tell, put for me injection. I need to stop diarrhea. But the diarrhea is to remove toxic from your body. Of course, there's a sometimes all limit coming out. So that's where you can just use this herbal remedies to reduce your impact. Other than that, what I advise is try to don't take any medicine for minor son. For major son, of course, you still as a follow. But I have seen my own students where they sometimes take 20 to 30 pills. Different students, they actually after 6 months of period when after I train them the yoga, they stop taking any of pills. But before they stop taking the pills, because as they start to reduce, they will go for a regular checkup at the clinic, to the hospital, the doctors. The doctors say, okay, now you're fine for this, you can stop this. After 6 months, I even have some entirely stopped the entire medicines. That means they are doing regularly yoga exercise every day. Because yoga, like I said, there are a lot of yoga asanas. So I teach for her because she have a health problem. So I just teach her health yoga exercise. Some people who have a weight problem, there's a different yoga exercise. So each problem in our body, they have a different kind of yoga exercise. Sometimes we have a common yoga exercise. Okay, this person and A and B, they actually have a different problem, but we only teaching a yoga exercise for person for C. So sometimes yoga masters, I explain them. Maybe you can mix. Maybe you can first start with yoga exercise for A, then you can start for the yoga exercise for B. Because the C person is not there. If a C person there, then means you teach 3 types of yoga also into it. So all of them, because sometimes it's not easy to handle all students at one shot. That means, but sometimes if you have a more less club, maybe you can just focus on each particular students. Okay, you have this problem. Okay, you do this. You have this problem. You do this. So how you want to do this is all depends on us. So what is a yoga? Basic movements, soul, and our body. So what is soul and our body? Because once there's a lot of theories on this. Some people tell after we die there's no more soul, like we saw in science. Or some people tell the soul leave to earth and go for the next stage. So there's 2 different things actually. So if you want to increase biomagnetism, the best yoga what I have seen now is Kai Kalpa under Varatri Maharishi. Kai Kalpa is also they call it as anti-aging. So you must just be aware there's a lot of anti-aging. So this is totally a different anti-aging. Although some of them they teach these methods, but make sure you train under the qualified teachers, because there's a lot of unqualified teachers are training this. In India, I think there's very easy to get this Kai Kalpa. This Kai Kalpa, they have used this and train Indian armies, Indian police, and they also come out with some medical reports, scientific a lot of anti-aging. So this is totally a different anti-aging. Okay, now although some of them they teach these methods, but make sure you train under the qualified teachers, because there's a lot of unqualified teachers are training this. In India, I think there's very easy to get this Kai Kalpa. This Kai Kalpa, they have used this and train Indian armies, Indian police, and they also come out with some medical reports, scientific a lot of anti-aging. So this is totally a different anti-aging. Okay, now although some of them they teach these methods, but make sure you train under the qualified teachers, because there's a lot of unqualified teachers are training this. In India, I think there's very easy to get this Kai Kalpa. This Kai Kalpa, they have used this and train Indian armies, Indian police, and they also come out with some medical reports, scientific a lot of anti-aging. So this is totally a different anti-aging. Okay, now although some of them they teach these methods, but make sure you train under the qualified teachers, because there's a lot of okay, maybe you can the video. Okay, sorry, the voice and the video was not synchronized yet. Okay, no problem. The video just now you saw was how the COVID-19 invaded lung. The cilia had type projection that move around to keep the mucus and the debris of the lungs. That means whatever we breathe inside, we have the lungs, there's a layer of cells. What will happen? The COVID-19 will just go and attack the cells. Okay, just now you see the red color, that's the cells that have been attacked. So the cells are get infected and died and we shut off. So the cells main thing to do is to ensure that no debris. But once the cell is died and shut off, you shut off the functions. So as he's adding to the debris, that means already there's some debris entering here. The dead cells also already consist debris. So adding to the debris and hindering the body ability to keep the stuff out of the lung and the trachea, preventing inflammation. Okay, so what will happen once so like I said, biomagnetism. So it's when less biomagnetism, it tends to die more faster. So because they don't have a much healing power very fast. That means now I'm healthy, I'm healing much more faster. Okay, adding to the hindering the body ability to keep the stuff out of the lung and the trachea, preventing inflammation. Okay, so what will happen once so like I said, biomagnetism. So it's when less biomagnetism, it tends to die more faster. So because they don't have a much healing power very fast. That means now I'm healthy, I'm healing much more faster. Okay, adding to the hindering the body ability to keep the stuff out of the lung and the trachea, preventing inflammation. Okay, so what will happen once so like I okay, let me go this video was just was how the because but okay, I'll come back to this video. So what will happen now is once the inflammation happen, it causes damage, and the damage get more inflammation. This is why some people we explain why we have dry cough. That means your cells are dying off a lot. So you need the time that cells to recover back and to create new cells. Your body need to create new cells to replace the dead cells. So they won't allow the debris to go inside. But if you're biomagnetism, so the body time will take times to create new cells. That is where people go for ICU or under the breathing apparatus. So you may understand this is why we are very important to do yoga and pranayama. So you can just keep on very good and very. So the second video is actually what you see is the 3D model of a lung patients. This is taken from a COVID-19 lung. They use a 3D module. You see the green color just now in the video. That is all is full with mucus. That means it's severely very bad. That means their cells are already died a lot. So it's become a mucus into their system. So that is actually how it's looked into a COVID-19 patient. So COVID-19 patients is how this is how we actually going. So some people tell, oh, okay, I'm actually healthy, but how true are you healthy? Are you really healthy, or are you just normal healthy? Because if you're really healthy, that's a different thing. If you're just a normal healthy, then you can just go for a different kind of environment. That means I'm strong. Okay, my immune system is strong, but you still have to take precaution, because what kind of healthy also, or what kind of exercise also, the pathogens that come maybe some stronger. So sometimes our body will take time to recover back and to fight back. And you should see as a early stage of the COVID-19 in China, not all of the COVID-19 patients are actually given medicine for treatment. Some of them recover by their own self without any medicines. That means, but not all of them. Some of them, because their immune system is very high. So you understand here, immune system playing a very vital role compared to all other things. So to increase immune system, eat healthy food, eat a lot of good things, and ensure that you just keep on your really fit, body fit. You do exercise, you nicely do pranayama. So there's a lot of things. So now you can see a lot of people now are going outside eating junk foods. But junk food will happen, it do impact this one. That means consuming or alcohol. Okay, some people are social alcohol once in a while, but some people are regularly taking alcohol. Regularly taking alcohol reduce your immune systems also. See, when you are talking about here, Manila oblongata, this side, this is what will happen. That is actually to maintain our balance. So when you take a lot of alcohol, it's actually impact here. So our balance in the body actually move on. So you can see some people who drunk, they're not able to walk properly because it's impact here. So understand, people for social drinker and a drunk is two different things. So there's a lot of things people say, oh, I'm just once a while going for drunk. Yes, once a while you went drunk, but you also impact your body immune systems. So during your drunk time, if you are impact, someone comes sneeze to you or they carry any other pathogen near you, what will happen is your body very easily can capture the particular pathogen and spread more faster. Because by the time you want to recover from the alcohol impact, you already have to recover from this new pathogen, because your body was not in the state for recovery. It was already in non-balance. So this is what I normally tell to people. Yes, you may take alcohol, but don't go for drunk, because you may tend to capture some diseases from outside while you're coming back. So this is why we're talking so many things about COVID. We're talking about this, we're talking about now a lot of medicines. Even Trump also came up with some medicines. But so far there's no medicine that confirmed can cure COVID. That is for sure. But Ayush, Minister Ayush, they're coming out with some programs where they ask to go for yoga, because they found out in yoga and some Ayush medicine, under Ayush, Ayurvedic, homeopathy, this type of medicines as help COVID patient to recover, or help people who before get COVID to increase their immune systems. So back to Sun, your biomechanism is important, your immune system is important. Without these two, you how much you go to gym, how much you do yoga, because you, like I tell you, yoga, there's a lot of yoga. They even started some time back hot yoga. Hot yoga, you put it in one room and they'll make you sweat first. Then they ask you to do hot. That means they put the heater here and there. That one actually started in Western country, because there, if you do a normal yoga exercise, also you don't sweat much because it's cold weather. So you the time, so that's why they come out with a hot weather. But this hot yoga actually now spread to all over the world. They're thinking someone, oh, this your hot yoga is actually very good. But for my country here, I think once I just walk in the road and go, I think I'll be start to sweat. In a short while, I'll just start to, you can see some sweat, because we are in a hot and cold weather. I mean, it's mixed tropical sun weather. So we just do not need this. So when we do a normal yoga self, even though we do in an aircon room, if we do a proper yoga asanas, we actually can sweat. We can actually break down. You can see the sweat breaking down. So it's actually, there's a lot of yoga. Some people come and ask me, is this yoga better? Or they can sometimes come and ask me, what type of yoga you're teaching? I just tell them there's only one type of yoga. Of course, they break down like Iyengar yoga, because he used more props. But his yoga asanas is same. Just what he used props. Or some people, they come up with us, and like myself, I can come up with my own methods to teach. That means for to become a flexibility, there's a certain thing. After I do some research, I come out, okay, based on your tendon, your muscles, your whole body, how all the muscles pull. I mean, when you what muscles actually pull back, when you touch a floor down, what muscles actually pull from your back. So once a yoga master able to understand this, they actually can easily teach and cure people, because you first a yoga master need to understand that human body. We also are taking this as a what do we call medical. They learn about human body also. Yoga also, we have to learn human body. So when you learn the human body, you actually can do what understand better. So okay, now you're pulling your arms here. Okay, what actually muscles are pulling this side? Okay, here what is on? This is hard, this is soft. So why is here is hard, why is soft? So sometimes this is because of extra fatty layer. Okay, so here maybe fatty, maybe here is not fat, not fat. So what you will need to understand. So when we touch a student and we want to bend something, so we must able to know by the pressure that we're bending where actually they are stuck. So you may know, okay, this student is doing this exercise, turning this side. So he actually have some problem with stuck with some other places here. So body, you must understand. First, you will not understand biomagnetism. Once you understand biomagnetism, then you must understand how your body function works. So when I turn here, okay, when I turn here, this particular nerve system actually is come to the spinal cord, but here also as an impact. So you must know, okay, some people they tell, master, I cannot turn my head. Okay, why you cannot turn your head? Because some of your nadis, that means we call limb systems, we got 72,000 limb systems. This is how the Varma masters they use for giving treatments. So acupuncture also, in Chinese acupuncture also, they use this as a similar limb systems. So they know, okay, for you, this limb have already a block. So we need to identify the limbs. So there's a lot of experts there. So even myself, I'm still learning, because even though this is yoga, Varma is a non-stop learning process. There's a lot of process. Once you learn already, you think once you learn, the next thing you go, you'll be learning more. Again, you'll go, you'll be learning more. So you were just learning. You will be learning so many things there. So at the end of the day, there's a lot of things that you should supposed to learn. So you understand. So body, biomagnetism, two different things, but they are merging together. Physical body, astral body, cosmo body. So that we break it to three. Okay, so this is a physical body, cosmo body is a then the astral body, the biomagnetism, everything. So there are three stages of a body into our sun that we should understand. Why? That means how to understand our body. You see, you don't need to go and learn about a lot of things. You learn about your body. You're sitting in a house, you just move your head. Once you move your head, you just see that there's a, okay, these are moving here. I feel something here. That means you know your limb and whatever muscles your nerve is going through here. So that is how I learn my own body. Then I go by observe. Okay, I observe my student. I go outside when people are walking in the normal time. I see how they walk. Okay, this is how they walk. Okay, so when I see my student, I'll give them some yoga asanas to do first. For new students, I give them some yoga asanas. When they're doing the yoga asanas, I can identify them where they actually have some problem, where is actually their lock. So normally when I give them the yoga asanas, okay, this one maybe you can move really nice, but this one they just come in, oh, I cannot move here. That means they have a lock here. So I can identify, okay, you have this problem here. So same thing, your feet is actually what we call this entire feet. This is, I mean, my hand, but I just keep it, we take this as a feet. Our whole body, nerve system, everything coming here. So that's why when we massage, I ask my student, okay, the next level to identify where the problem in your body is, you massage. You give a slight pressure from here. This is actually, can tell it, the top here is your brain cells area. This is your pituitary gland. This two is your eyes. This is your ear. Then thyroid, parathyroid, thymus. The one that going in your leg, they have a curvature inside. That is a small intestine. Outside is the big intestine. So there's up to your lower here is your back here. So
Segar, sir,
yes.
can we just make it as much as possible to get into the final program?
Okay, sure, can. Okay, so I just wrap up. Give me around 2 minutes. I just
Yeah,
wrap up.
yeah,
Okay,
please.
thank you. So when you press at anywhere the pressure points, you actually, when you feel the pain, that means the pain actually is not from here. The pain is somewhere in the body. So later stage, maybe I'll try to, maybe if in the future I can try to, or any question, you can just drop me a mail or WhatsApp me. So I'll just explain you how it's. So now I just going to finish off and just going to teach you Nadi Sutta Pranayama. This practice alternating between the right nostrils and left nostrils, you inhale, it unblocks and purifies the nadis. The yogis believes the energy passage that carry the life force and cosmic energy to the body through this. That means when we alternate, they are actually the twist. They can actually they give a recall process. So there's a pilot study also been done between 7 days of practicing this technique. Overactive nervous system essentially been balanced. That means people are not ascend. Then a study of 90 people with high blood pressure found that nadi sadhana lower the blood pressure and improve the blood focus. So okay, before that, I'll just gonna teach you basic breath awareness. You just sit not like this. Begin noticing your breathing. Okay. Just see what is make your breath shallow or what make it speed. So if you Kavita, you feel here what's making pushing, what is done. This information is very important to create stress listen. Plus, you when you become aware of your breath, you tend to slow down. So now you're breathing heavily. You see that is just focus on it. Breathe through your nose. Observe the inhalation and exhalation, which is happen faster. Do you inhale faster or exhale faster? Don't manipulate them. Just watch. Continue for 2 to 3 minutes. You just focus and then listen. So this one you try to do. So sometimes you can feel you're breathing in much more faster. You're breathing out much more slower. That means you're going in the trachea, all the hole that going inside is much more clean. But coming out, you already have a stuck. So that is where you had to do some different type of pranayama to clear your trachea systems. Okay. Now we just go back to the sadhana pranayama nadi. Okay, you just keep your left hand like this, put on your hand. You sit in your lotus pose. The right hand you just put like this. Okay, you inhale, close your nose, exhale. You inhale back the same nose that so you inhale back, close, exhale, inhale, close, exhale. So when you're doing that, make sure your nose is don't press so harsh, but you just give a gentle lock. Your mouth should be closed. Okay, so you just inhale. So keep it now. I inhale 1, 2, 3, 4, 5. I close. I exhale 1, 2, 3, 4, 5, 6, 7, 8. So my exhale, I always keep it more. So your lungs function, you actually can move much more better. So you can do a lot of things. I think so. This one actually can make your lungs much more stronger. This particular one, because you're actually inhaling with your biomagnetism going into this, so your lungs will be much more have a better function, better things. So you can just have a what we call more relaxing, more immune system increase, more biomagnetism. So for your COVID, for you to stop your COVID COVID, you cannot stop the COVID to attack your cells, but it can attack because it's coming from the outside, unless you cover it. But once it enters inside, you can use your immune system to stop it. So it depends on us. There's a possibilities to stop the COVID for coming outside is less because not all the time you're going to use mask sanitizer. Even though we use mask and sanitizer, the COVID maybe people sneeze at the back you. Okay, you never know, people sneeze at the back you. The particles can go on your shirt. Okay, it will stuck there. So you just go home maybe 10 minutes or half an hour or 1 hour will go back. So you just remove your shirt. Once you remove your shirt, some people just tend to put like this. Once you put them, once you hit, so you call it the dust particle, it'll just come out. And you just happen to anybody just next to it, you can inhale back the particle. So that is also a higher risk for us. So even though we're outside, we wear masks, we put sanitizer, but the shirt that we are wearing, the pants that we are wearing, how we want to make sure that it's clean, because we're not going to sanitize the entire body when we enter in house. So there's a possibility that the COVID drop particles are still in our shirts there. So if we are good in immune systems, then of course we still will get a COVID inside it, but our immune system will fight the COVID and cure us faster. So this is what I like to say. Okay, thank you for you all. Have a nice day. And this one, Mr. Amuda, Mr. Sada, I think this is a good opportunity to spread the COVID awareness and how to prevent this, and a very good reason. Thank you.
Thank you. Thank you very much, sir. Really, it was been a pleasure for us because you have covered from top to bottom about all the muscles, mechanisms, as well as how the body mechanisms also involving into it. So that was really a very great pleasure for you, for all of us to have you here. Thank you very much, sir.
Welcome.
Yeah.
Okay. Namaste. Vanakkam.
Namaste, sir. Namaste. Thank you. Next, I call upon Amuda for, sorry, we'll be going for the vote of thanks. So now I invite Ratna Sabapati, the organizing secretary of Patanjali College of Yoga and Research Center, to give vote of thanks. Call upon Amuda for, sorry. Saba? Saba, can you just unmute yourself?